morning from Miami Beach. This is Dr. John Bennett broadcasting for Neurosurgical TV. We have the honor of hosting Victor Hugo Perez, a famed neuroanatomist from Mexico City, who's doing a series of neuroanatomical webcasts. We'll start off right now. Okay, Victor, welcome. Good morning.
Thank you very much, John Bennett. First of all, I want to say that I am very, very grateful with Dr. Binshu, who has invited me for these lectures, and also a big honor because I have been invited by Dr. Juha Hernesniemi to China. I have been there in 3 different occasions, and that's amazing for me. So today I'm going to talk about posterior cerebral artery. Let me share my screen. So can you see it in the whole screen?
Not yet. It's not full yet. It's not full yet. Put it in presentation mode.
It's okay now? Oh, okay.
Not yet. Oh, okay. It fell off there.
Okay. Okay. Now I think it's okay.
There it is. Perfect. Perfect.
Okay. So I'm going to start with this video that in this I am showing here the posterior cerebral artery arising from bifurcation of basilar artery. So in this video, I am showing these small branches coming from P1 and P2. P1 segment from bifurcation to the junction with posterior communicating artery. As you can see in this video, these posterior cerebral arteries are giving rise to small branches to the interpeduncular fossa. The most important artery in this case is this, the thalamo-perforating artery. Other arteries coming from here are the mesencephalic arteries that are branches very, very small. And here we have some branches going to the crus cerebri, to the brain, to the pedunculus. I think I can repeat this video because I think it's very, very interesting to look this dissection. Both posterior communicating arteries are smaller than posterior cerebral arteries. This is the normal pattern of presentation of this posterior part of circle of Willis. This is the third cranial nerve between posterior cerebral arteries and superior cerebellar arteries. Interpeduncular fossa, posterior interpeduncular fossa. Okay. The posterior cerebral artery arises at the basilar bifurcation, is joined by the posterior communicating artery at the lateral margin of the interpeduncular cistern, encircles the brain stem, passing through the crural in the anterior part, an ambient cistern to reach the quadrigeminal cistern, and is distributed to the posterior part of the hemisphere. Here we have the mesencephalic branches coming from the P1 this picture is really nice because we can see the trajectory of these small arteries. The sylvius aqueduct, quadrigeminal plate, and the mesencephalon, mammillary bodies, and here is the hypothalamus. In this picture, we can see the lateral aspect of the crural and ambient cistern. Crural in the anterior part and cisternal and ambient cistern in this part. Here we can see P2A or P2 anterior, P2 posterior part of posterior cerebral arteries. The fetal configuration in which the proximal posterior cerebral artery is small and the posterior communicating artery provides the major supply to the posterior cerebral artery and is larger than the P1. Here we have the basilar artery. In the right side, the superior cerebellar artery, posterior cerebral artery that is coming mainly from supraclinoid carotid artery. This is a fetal configuration, and this is P1. As you can see, this is very short, and here we have an special configuration, anatomical configuration of this posterior cerebral artery. Which of these is P1? We know that this artery is posterior cerebral artery. I think this is bifurcation, this one, because this artery is joining with posterior communicating artery. So this is very small artery, P1, and is very large. And this one is superior cerebellar artery. So this other artery is a branch coming from P1 in the right side here. So the bifurcation is this one, not this, is this. A hypoplastic arterial segment, mainly in the circle of Willis, is defined as one having a diameter of 1 millimeter or less. So these small arteries are less than 1 millimeter. So they are called hypoplastic arteries. The posterior portion of the circle of Willis sends a series of perforating arteries into the diencephalon and midbrain. Some of the perforating branches arising from the upper part of the basilar artery overlap with some of those arising from the posterior circle. In this video, we can see this anatomic configuration. For example, in this case, I could not find a posterior communicating artery. Instead, we have a posterior cerebral artery, or this artery, but in this case, the main flow is coming from posterior communicating artery arising directly from the supraclinoid carotid artery. There is no communication between these arteries, posterior communicating artery and this this branch coming from bifurcation. In the left side, we have P1, P2, and posterior communicating artery. And these branches going to the interpeduncular fossa. The P1 segment, also called the pre-communicating segment, extends from the basilar bifurcation to the junction with the posterior communicating artery. A fetal configuration in which the P1 has a smaller diameter than the posterior communicating artery and the PCA arises predominantly from the carotid artery, occurs in approximately 1/3 of hemispheres. A normal configuration in which the P1 segment is larger than the PCOM-A is found in nearly 2/3 of hemispheres. A few hemispheres will have a posterior communicating artery and P1 of the same diameter. A fetal configuration may be present on both sides. In some brains, I have cut some arteries like you are watching in this slide. I cut the basilar artery in order to make some dissections of brainstem. But in here is very important to see these two superior cerebellar arteries, in this case, in the left side. So let's go to this video in order to show these fissures. Right side, P1, and in this case, I cut this posterior cerebral artery in order to show the small branches coming from P2. These branches are going to the crus cerebri, to the brain peduncles, as you can see in this video. The relatively constant branches arising from P1 are the thalamo-perforating artery, which by definition enters the brain through the posterior perforated substance. Posterior perforated substance. The medial posterior choroidal artery directed to the choroid plexus in the third ventricle and lateral ventricle. The branch to the quadrigeminal plate and running to the cerebral peduncle and mesencephalic tegmentum. Hippocampal arteries are present, arises in the crural or ambient system, and is the first cortical branch of the PCA. It supplies the uncus anterior parahippocampal gyrus and hippocampal formation and the dentate gyrus. So here we have posterior cerebral artery, and this is hippocampal. This is hippocampus. So here we have the hippocampal artery coming from P2. This is a beautiful picture to show this small artery, parahippocampal artery. Here we can see in this slide P1, posterior communicating artery, this is hypoplastic. P2 divided in two segments, P2 anterior, P2 posterior. And here we have the hippocampal artery. So this picture I showed you last lecture, and I think is very, very interesting because you can see the basilar bifurcation, superior cerebral arteries, the third cranial nerve, and look at this. This is P1 in the right side, P1. This is very, very small, hypoplastic, but it has a fenestration in here, this short segment and very small, P1. This is a lateral view, but let's go to see the superior view of this small segment. It's really amazing what we can see in here. The hypoplastic segment of P1, look, in this case, how many branches are coming directly from this hypoplastic segment, P1. Amazing, this anatomical variation. This is interpeduncular fossa and both third cranial nerves. The P2 segment begins at the posterior communicating artery, P2, lies within the crural and ambient cisterns and terminates lateral to the posterior edge of the midbrain. The P2 is divided into an anterior and posterior part because the surgical approach to the anterior and posterior halves of this segment often differ, and because it is helpful in identifying the origin of the many branches that arise from P2. The anterior part is designated the P2A or crural because its relation with the peduncles of the brain. The anterior part is the crural and peduncular segment because it courses around the cerebral peduncle in the crural cistern. The posterior part is designated the P2P or the ambient or lateral mesencephalic segment because it courses lateral to the midbrain in the ambient cistern. So here we have crural cistern and ambient cistern. So as I told you in anterior slide, here we have the posterior cerebral artery coming directly from supraclinoid carotid artery. We cannot differentiate in here the posterior communicating from the posterior cerebral artery. This is only one. And in the bifurcation of the basilar artery, we have a very short segment, and these branches going to the posterior part of the brain stem. Most probably, these arteries are the posterior choroidal arteries. We have two of them. Posterior choroidal cerebral arteries, anterior, lateral and medial. Lateral and medial. Another picture to show P2 segment is this one. Here we have the third cranial nerve, fourth cranial nerve, the pons, cerebellum, and temporal lobe. Let's go to magnify this picture. And here we can see third cranial nerve, posterior cerebral artery, superior cerebral artery, the fourth cranial nerve, and here we have some branches, some cortical branches going to the temporal lobe. Let's go to see this video, the next video. In surgery of this region, it's very important to make a good dissection, a good and careful dissection of the arachnoid membrane to define, to identify clearly the small branches in this region. We can see the fourth cranial nerve, arachnoid, and once we have dissected this, we can show this beautiful region of the brain. The crural system, ambient system, fourth cranial nerve, the crus cerebri, the peduncle of the brain. The P2A begins at the posterior communicating artery and courses between the cerebral peduncle. In this case, we have P2A, P2 anterior, and P2 posterior. These arteries are going to irrigate this small anatomical structure. The pineal gland. This is pineal gland. Here we have the mesencephalon, substantia nigra, the aqueduct of Sylvius, and here we have branches coming from the posterior choroidal artery, the medial posterior choroidal artery, going to the pineal gland. Here we have the splenium of the corpus callosum, and here we have the cortical branches of posterior cerebral artery. Pineal gland. The thalamo-geniculate arteries arise directly from P2 beneath the lateral thalamus and penetrate the part of the roof of the ambient cistern, formed by the geniculate bodies and surrounding area. The posterior cerebral artery most commonly gives origin to 2 or 3 thalamo-geniculate arteries, but there may be as many as 7. They arise near the junction of the crural and ambient segments, with a nearly equal number arising from each segment. At the end of this lecture, I'm going to show you a beautiful video to look this interesting area. This is the posterior aspect of this posterior cerebral artery, and here we have the pineal gland and several branches going to the quadrigeminal plate and also to the pineal gland. Here we have the venous, the veins in the posterior aspect. Superior quadrigeminal the pineal gland with some arachnoid. These are branches coming from medial posterior choroidal artery. These are trochlear nerve. And these are arteries coming from superior cerebellar artery. The P3 or quadrigeminal segment proceeds posteriorly from the posterior edge of the lateral surface of the midbrain and ambient cistern to reach the lateral part of the quadrigeminal cistern and ends at the anterior limit of the calcarine fissure. The posterior cerebral artery often divides into its major terminal branches, the calcarine and parieto-occipital arteries, before reaching the anterior limit of the calcarine fissure. The average length of the P3 segment is 2 centimeters. The P3 from both sides approach each other posterior to the colliculi. The point where the posterior cerebral arteries from each side are nearest is referred to as the collicular or quadrigeminal point. This is quadrigeminal point here. This is quadrigeminal tubercles. Like in this picture, like quadrigeminal colliculus. So here is P4, posterior cerebral artery, fourth segment, also known as cortical segment. This P4 includes the branches distributed to the cortical surface posteriorly. This is parieto-occipital artery, and it begins at the anterior end of the calcarine sulcus. This is calcarine sulcus. The P4 segment includes the branches distributed to the cortical surface. The dysfunction caused by occlusion of the individual posterior cerebral artery branches has been reviewed. Occlusion of various branches may also lead to some stasis disturbances caused by involvement of afferent pathways in the medial lemniscus or thalamus, motor weakness caused by involvement of the corticospinal tract in the internal capsule or peduncle, memory deficits caused by involvement of the hypothalamic pathways entering and exciting the mammillary bodies, autonomic imbalance caused by disturbances of the sympathetic and parasympathetic pathways in the anterior and posterior diencephalon, alteration of consciousness caused by ischemia of the midbrain reticular formation, abnormal movements caused by involvement of cerebellothalamic circuits in the midbrain and thalamus, and endocrine disturbances caused by involvement of the hypothalamic pituitary axis. So it's very complex, the anatomy of this posterior cerebral artery, but amazing the alterations that we could have if we have some infarction or damage to this important artery and their branches. This image shows a persistent common trigeminal artery, primitive trigeminal artery, and what appear to be two posterior cerebral arteries. Posterior cerebral arteries, this one, and basilar artery, and this is the trigeminal primitive artery. Let's go to see these final slides. In this case, I dissected this brain in order to show this beautiful anatomy of posterior cerebral artery. This is a hippocampus. Temporal lobe has been resected. Let's go to see. This is an amazing region of the brain stem. The branches coming from posterior cerebral artery. Let me show you a video about this. Posterior cerebral artery, P2A, P2 posterior, and the branches coming from posterior cerebral artery going to the crus cerebri, to the peduncle. Very small branches. Choroid plexus in the lateral horn of ventricle. Anterior choroidal artery, and this artery is posterior choroidal artery. This area seems to have a few arteries, but look at this. This is, for me, this is really amazing. Here we have the fourth cranial nerve, and look this area. It's really amazing what we can see in these branches coming from posterior cerebral artery. In almost all the brain that I dissected, I can see these numerous branches coming from this posterior cerebral artery. Really amazing to see these numerous branches. Anterior choroidal artery, plexus, choroid plexus, and the ambient cistern. This is ambient cistern. So thank you so much for your attention, and let me tell you that it's a big honor to be here with all of you. Thanks, Dr. Binshu. Thanks, Dr. John Bennett. And of course, Dr. Yuka Hernesniemi. Thank you so much.
Okay, Ben?
Thank you, Victor. Thank you for your very detailed presentation of the anatomy of PCA, and actually this is very useful in the real operations. Thank you.
Thank you, Binshu. Hello, Takashi-kun. How are you?
Good evening, Victor. So thank you for the very informative lecture. We seldom encounter PC aneurysm in Japan now, and so but very informative for young residents, our colleagues. Thank you very much.
Thank you so much.
Okay, very good. Well, one thing I wanted to try, Victor, and I'll get Jesse involved here. If any Chinese neurosurgeons or residents have a question, you can ask Jesse, the Chinese interpreter, directly, or you can text her your question. They can text you, right, Jesse?
Yes. Yes, thank you.
Yeah, they can text her. You don't have to get on the screen. You don't have to be live. You can just text or just tell Jesse your question. In the
Okay.
meanwhile, we'll continue on in the panel. Anybody in the panel want to make a comment? Zainab, are you there from Africa? Go ahead.
I think Said Taha has a comment.
Oh, yes, I'm sorry. Go ahead, Saeed. Yeah, Saeed does the French neurosurgery grand rounds. Are you there, Saeed? He's there. He's trying to get in. Can you hear me? Okay, let me make sure you're in there. Sometimes this is not working right. Okay, there you go. Okay, hold on. Let me try to get you in there, Saeed. Because sometimes
Said Taha
oh,
is
there
here.
we go. Okay, Saeed, very good.
Hello,
Hello,
thank you.
Said.
Hello. Thank you very much, Victor, for this lecture. It's a pleasure to have you. I appreciate the anatomist work, the anatomic work, especially in the basilar apex. I'm interested by this region. And as we know, this region is in relation with the embryologic development, especially with the time of immersion of the two vertebral arteries, and the time of the regression of trigeminal artery is the base the final morphology of this arteries, of this complex basilar apex. It will be symmetric and cranial, or asymmetric cranial, or basal. It's a very interesting slide, and I appreciate what you do. Thank you very much.
Thank you, Said. Thank you.
I hope if you accept to do some works about my friend Brassier. It's a French anatomist who study well this region. And I can send you his paper. His very interesting paper.
Okay, a honor for me, Said.
Thank you very much.
Thank you.
Yes, Saeed heads the French Neurosurgery Grand Rounds, and he's from the island of Reunion. It's an island off the east coast of Africa. You did your training in France, Saeed, or?
Yes, it's Reunion. It's a French department. It's overseas department, and yes, I do my study in France and Marseille, in Paris, and Marseille and Montpellier.
They have some big neuroanatomy centers there in France, right?
Yes.
They have some big
We have the greatest anatomists like Brassier, Mercier, Fournier, Maldonado, Igor Maldonado, and some. There are some school of Toulouse with Lazorte, who was a great neuroanatomist. Marseille with Salomon and his team. Angers, Mercier. Rennes with Brassier,
for the history.
Lille, that there is, yes.
Oh, wow. Victor, have you been over there for France for the neuroanatomy community? Have you been there, Victor? Can you hear me? Oh, you're muted, Victor.
In French, you mean?
You're muted, Victor. You're mute. You're mute.
Okay, yes, I have been in the French webinars, very interesting cases, but I speak just a little bit French. So,
Okay.
I'm going to study French. It's a
Okay.
really nice idiom. Thank you. Yes.
Thank you very much.
Very good. Okay, any more comments from the audience? Okay, Victor, what is it next week? What is next week?
We are going to review the cerebellar arteries and vertebral arteries.
Okay,
It's an
very good.
interesting topic. And the last one is going to be about the anatomy of the spinal cord, vasculature anatomy. That is also very interesting because I have been working spinal cord for almost 15 years, and I can show you some interesting topics about that.
Very good. Ben, how are the Chinese numbers today?
Now totally we have more than 4,500 audience totally.
That's
For
cumulative.
Victor's
I think
visit.
that kind of
Yeah,
adds
yes,
up.
yes.
Adds up.
Yes.
Wow, amazing.
So
Yes.
we're getting to the Chinese.
Victor, may I
population.
have a suggestion? If you're talking to the spinal arteries, maybe you're better talking about the vein at the same time.
Yes.
About what?
Vein,
Veins,
artery,
okay.
and the vein
Yes.
at the
Yes,
same time.
yes, of course.
Yeah.
They are very, very important. Binshu, can you put in the screen the number of a
Screen
screenshot?
share?
A screenshot.
I can do it, Ben, if you want. Let me just hurry you and I'll screen share it, Victor. It'll be my chance to present. Okay. Let me screen share you, Victor. Just give me a second. Oh, I'm restricted. I can't screen share. I'm sorry. Okay, I guess you can. Okay, so we got the numbers, and I can get it exactly. Yeah, it's like 4,600. So that's great. Okay.
Maybe Jesse can put the screenshot in the screen, a picture about the number of assistants in China. You know, this is really amazing. I would like to have the okay.
Yeah. It's 4,515.
Okay.
Very good. Very good. Okay, everyone. Thanks. Thanks. And we'll see you next
Amazing.
week.
Okay, see you.
Bye-bye.
Thank you.
Bye-bye.